If you're feeling dizzy all the time, you've gone to the doctor has prescribed you many medications, you've used many things like Vertin and other stuff, you've got multiple tests done, MRI scan, Dopplers, heart issues, you've got them all sorted out. Your dizziness is not coming down. What could be the reason? If you're snoring at night, the answer could be sleep apnea. When you snore at night, your tongue goes back towards your throat and your breathing stops briefly, your oxygen drops, and you wake up without knowing. This happens multiple times during the night. The impact is that repeated oxygen drops, repeated waking up, blood pressure fluctuations, brainstem dysfunction could all be causing your dizziness. Please ask your doctor whether this could be the cause, and therein may lie the answer. In fact, CPAP may help you overcome this easily.